Hello, my name is Marissa Craig, and I use the Broad model to research the effect of patient-to-staffing ratios in the American healthcare system. The first step is to ask a complex problem. I ask the complex question, what is the effect of patient-to-staffing ratios in the American healthcare system? When referring to safe patient-to-staffing ratios, many questions are asked in reference to the possibility potential of healthcare reform. This change alone would majorly affect the American healthcare system's functionality. It is asked, what would an acceptable ratio of healthcare providers to patients even be? Should this be regulated by government officials, insurance companies, hospitals, or other medical providers? Should these regulations be based on state population, census, level of acuity, or department? How will we ensure these regulations are enforced, or that they will be of any observable benefit? What are the current problems and results associated with unregulated staffing ratios? All of these questions can be answered through an interdisciplinary approach so that a holistic solution can be made and an obtainable goal reached.
First of all, I really gotta say, I like your confidence for having your camera on, but also I really like how you went more in depth on the complex problem instead of just stating what you had written down on the slide, and you elaborated on it more.
All of these applicable complex questions pertaining to patient and employee safety can be answered through the use of critical interdisciplinary thinking. Healthcare is also considered as a holistic field. Thus, we also must explore this problem in the same manner to create a holistic solution. With consideration to the healthcare field, specifically that of patient-to-staffing ratios, a comprehensive solution may be difficult to obtain considering the multitude of disciplines this topic includes and affects. Implementing an interdisciplinary mindset and relating to more than one branch of knowledge will allow for a more inclusive solution. As an employee in the healthcare field, I have personally experienced the harsh realities of unsafe staffing ratios, but also as a potential patient, you should care about this issue and the quality of care that you had received for you or your loved ones. The American healthcare industry currently employs over 18 million Americans and annually treats 87%, or 285,534,000 Americans yearly.
I originally wasn't gonna comment this soon again, but I really liked how you brought up your personal experience in healthcare. My mom, she's a physical therapist, and there's only four other physical therapists where she works, and she has to split sometimes up to 60 patients a day between the four of them, and it's really hard to get all the work done, and I think patient ratios is super important.
Integrative thinking allows for new points of connection. From looking at the graph, you can see both the viewpoints from the staff and the patients, allowing for new perspectives that could be deemed essential in solving this issue. Patient-to-staffing ratios directly correspond with the outcomes involved with the American healthcare system. Psychological factors can affect one in a variety of ways. The healthcare industry is more commonly known to produce a significant increase in psychological, mental, and emotional distress within the workplace, which then can also affect patients' overall health. The overwhelming emotions caregivers often experience with inadequate staffing lead to frustrations of not physically being able to provide adequate care to the abundant number of patients. The healthcare industry also provides higher burnout rates when compared to other occupations. Emotions relating to burnout often suggest dissatisfaction, depression, and preventable mistakes. While healthcare workers may suffer from related psychological distress, this can also affect patients. The mental, emotional, and physical well-being of patients and healthcare staff is fundamental to creating impactful results. The importance of patient-to-staffing ratios should be implemented through regulations or legislation. This would ensure sufficient personnel to provide adequate ratios. When healthcare professionals fail to recognize the association between staffing ratios and patient outcomes, laws and regulations become essential. Some regulations regarding staffing ratios have been established, such as the Registered Nurse Staffing Act, but never even passed through Congress. It also was not implemented for all states and did not include security for other healthcare workers, such as nursing assistants. Research conducted by the American Nursing Association found that 14 states currently address nurse staffing in hospitals with law and regulations. 7 states require hospitals to have staffing committees responsible for staffing policies, and 5 states require some form of disclosure and/or public reporting. Coincidentally, Kentucky is not in any of those findings and does not currently ensure any safety measures regarding patient-to-staffing ratios. This requires patient-to-staffing ratios to rely solely upon healthcare facilities' policies, if any are even in place, and vary from company to company. This legislation would ultimately benefit patients as well, as they would be protected from negligence and inadequate staffing and cut on waiting times. Safe patient-to-staffing ratios are critical to patient outcomes and should be monitored by the federal government to ensure these results. Once established, safe patient-to-staffing ratios will ultimately allow for multiple gains in the company and in government profits. Falls in proper documentation, distribution of wrong medications, improper use of equipment, infection, personal injury, or even death are all incidences in which the hospital or insurance company are liable. Safe patient-to-staffing ratios would ensure each unfortunate event from taking place, which would then lead to decreased misuse of company resources, lawsuits, workers' compensation, and insurance coverage. Nurse staffing has been found to be an important aspect in terms of quality of care and company financial outcomes. For employees, a manageable workload would allow for adequate, concentrated care. Hospitals would ensure safe, reliable care while also eliminating negligent costs. Regulated nurse staffing can provide a competitive advantage to hospitals and, as a better result, increase their financial performance, particularly in more competitive markets. Patients would receive more focused care while also deducting any unnecessary expenses such as extended stays, falls, or infection. This would also save the Medicare system funds, allowing for other projects to receive those funds. Ultimately, staffing ratios affect hospitals, insurance, and patients financially, which take resources away from other projects that they could be funding, affecting their profits. Overall, the lack of research regarding safe patient-to-staffing ratios startles me. It almost seems like it should be common sense. You have to have enough employees to be able to adequately provide for your patients. There are many passionate employees and researchers that have tried contributing to the legislation being made. A federal regulation has been in place for some time now, 42 Code of the Federal Regulations, 42 CFR 482-23B, which requires hospitals certified that participate in Medicare to have adequate numbers of licensed registered nurses, LPNs, and other personnel to provide nursing care to all patients as needed. This nebulous language and continued failure to enact a federal law, such as the Registered Nurse Staffing Act, has resulted in states into taking their own action to ensure appropriate numbers to be able to provide for their patients' needs. Even if the Registered Nurse Staffing Act did pass in Congress, many discrepancies would still be in place. Although this bill was a great step in the right direction, we still have miles to go. Although I have only scratched the surface regarding disciplinary connections relating to the safe patient staffing ratios, the use of interdisciplinary thinking is essential to solving problems holistically and should be further applied regarding the patient-to-staffing ratio crisis. Here are my references used, and I would like to thank you for taking the time to listen to my presentation regarding safe patient-to-staffing ratios. As a CNA, over the years, it has become abundantly clear that something needs to be done and there needs to be take action regarding inadequate staffing. It's something that's completely unacceptable, and if you or your loved ones were in the hospital or a nursing home or a rehab facility, need to be able to be properly taken care of, ultimately helping us with stress and ensuring their own safety.